Well, good morning. We're here today on the traditional territory of Treaty 6, and I acknowledge the Métis people who share a deep connection to this land. I'm David Shepherd, the Alberta NDP MLA for Edmonton City Centre and the critic for health on primary and rural care. I'm joined today by my colleague Nathan Ip, the MLA for Edmonton Southwest and our critic for jobs, economy and trade. Now, tomorrow will mark 1 month since the UCP cabinet was sworn in and assigned their current roles. And since that time, the government has remained invisible, silent, and seemingly inactive on the most critical issue impacting all Albertans, the crisis in our healthcare system. A crisis that continues despite repeated denials from Premier Danielle Smith and her Chief Administrator, Dr. John Cowell, who would seem to prefer to simply pretend it doesn't exist. Now, last fall, the two of them made a promise to Albertans that they would fix or reform the healthcare system in 90 days. Well, it's been more than 270 days since that declaration, and rather than admit their strategy is a failure, it seems Premier Smith and Dr. Cowell are willing to let Albertans continue to suffer within the crisis in the system and even potentially die. Adriana LaGrange, Alberta's new health minister, has apparently decided to join them in their post-election vow of secrecy and silence. She's yet to make any public statement or even really a passing comment on any of the issues challenging our healthcare system. And that list of issues is long and daunting. Rural emergency departments continue to experience temporary closures on a regular basis. Urban emergency departments like the Peter Lougheed Hospital in Calgary continue to have wait times of up to 13 hours. Hundreds of thousands of Albertans are still without a family doctor. Calgary patients are having to wait months to get an appointment for routine lab work. There remains just one Obgyn in Lethbridge, the province's third largest city, to serve all of the women in Lethbridge and surrounding area. And data from the UCP's own annual report shows that despite their claims, they've been falling behind on surgeries and surgical capacity in Alberta. And that's just highlighting a few. On top of this, while Danielle Smith and UCP spend their time holding photo ops and making announcements, we're seeing record numbers of Albertans dying from drug poisonings. Indeed, the latest provincial ambulance data on drug poisonings is alarming, showing 339 calls for opioid-related events during the week of June 26, 2023. That count far surpasses the previous peak of 276 calls from 2 years ago, in the week of November 29, 2021. And shocking data that was released on Tuesday shows that the life expectancy amongst Indigenous people in Alberta has declined by 7 years. A decline attributed in large part to the opioid crisis. Now, Premier Smith's decision to simply put her head in the sand over evidence-based harm reduction strategies is misguided and dangerous. It's costing lives. And her interference in the administration of healthcare continues to undermine trust and chase health workers out of the profession. And that, in turn, is hurting Albertans, both in terms of their ability to access care and quality of care that exhausted healthcare workers are able to provide, and in terms of the millions of dollars that are going into severance packages or lame duck reports that could instead be going to ensure Albertans can access the care they need and deserve. That's why yesterday we called on Premier Smith, Dr. John Cowell, and her chosen chair of her COVID committee, Preston Manning, to come out of hiding and justify why they're squandering millions of dollars on the Premier's pet ideological obsessions while the province's healthcare system remains in crisis. Dr. John Cowell himself, hired this past November, was given a salary of $360,000 for just 6 months of work. Then Premier Smith gave Preston Manning $253,000 sole source contract to oversee a $2 million COVID-19 review panel. Now, that panel was meant to produce an interim report that was expected to be delivered to her by June 30th, last week, and with the final report due in November, but there's no requirement in Smith's ministerial order for any of this panel's reports, the interim or the final report, to be shared with Albertans, even though Albertans are footing the bill. On top of that, the government's recently published Sunshine List shows that AHS paid out 23 severance packages in 2022, totaling more than $3.6 million. Now, last week, Danielle Smith said there will be more changes coming at AHS, promising specifically, and I quote, new faces who are going to lead the effort. So we can only wonder how much more that severance number is going to continue to grow and just who she might be eyeing to carry out her already politicized agenda. Just imagine if Premier Smith's focus was on saving lives instead of seizing more control and continuing to cause chaos in a healthcare system desperate for leadership, focused on collaboration, support, respect, and a commitment to science-based models of intervention and care. Now I'd like to invite Nathan to come to the mic.
Thank you, David. Thank you, David. Yesterday, the government produced Premier Smith's mandate letter to Jobs, Economy and Trade Minister Matt Jones. The direction given to MLA Jones is disappointing at best. In a letter that is mostly vague and lacking in any bold actions to lead our economy for the future, MLA Jones has been directed to lure skilled workers with a $1,200 signing bonus. When we look at what's needed to attract healthcare workers, $1,200 falls embarrassingly short of the $5,000 to $10,000 bonuses offered for healthcare workers in other jurisdictions. I fear it will not be enough to move the needle and improve staffing in our hospitals and rural health centers, especially at a time when there are more than 800,000 Albertans without access to a family doctor. As David said, just imagine if Premier Smith chose to invest $5 million she is willing to pay for reports and severance packages into a signing bonus that matches or exceeds other jurisdictions. That $5 million invested in offering a $10,000 signing bonus could bring 500 more healthcare workers to our province. Certainly, money alone will not be enough to show skilled workers in this province this province is serious about improving healthcare, but it is a start. I will turn things back over to David.
Thanks, Nathan. I recognize we're covering a lot of ground today, but the fact is, there is a lot of ground to cover, which is why we are here. Our healthcare system, at every level, in every way, is in crisis, yet we have heard nothing from this government or this new health minister on what steps they are going to take to address it. And Albertans deserve so much more from their government. At the very least, Premier Smith, Dr. Cowling, Preston Manning, Minister LaGrange should be transparent, available to answer questions. Now, the Alberta NDP is willing to work with the UCP government to end the chaos and the crisis in our healthcare system. We've spoken with frontline experts, frontline healthcare workers. We've worked to bring their ideas forward. We have a plan that Dr. Rick Spooner, the former chair of family medicine at the University of Alberta, said, and I quote, "Of all the documents on this subject that I have read, this one most palpably gets to the heart of the matter and offers practical solutions." That's our vision for primary care that we put forward on family health teams, with the goal of helping 1 million more Albertans be able to access their family doctor or other primary care professional within a day or two close to home. Our plan included the largest healthcare recruitment campaign Alberta has ever seen. We stand here today having heard nothing from this new UCP government on primary care, a crucial issue, not even just an update on the vague promises that they put forward earlier this year under Health Minister Coppin. The Alberta NDP is ready and willing to share our plan, our work with the UCP government, and to support them if they are truly committed to getting to work to end the chaos and crisis in our healthcare system. We want to see good things get done for Albertans. Thank you. We're happy to take any questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll start with questions here in person.
Hi there, Mason from Global News. I'm doing a story on family medicine today. You used the word crisis. How would you describe the situation of family medicine here in the province?
So at present, we have probably hundreds of thousands of Albertans who do not have reliable access to primary care. So that in itself is a crisis. That is what is driving the pressure that we are seeing in our emergency rooms in good part. When people do not have access to primary care, that means they are not looking after chronic health conditions. We are not diagnosing and catching potential future health issues early. That means people are driven to the emergency room. They are presenting sicker and in more complex condition. It's going to cost more and be harder to treat them for the conditions they have. So one of the most essential things, and you will hear this in every jurisdiction across Canada, is that we need a plan to increase access for primary care. In Alberta, sadly, we have lost a lot of family doctors because of the aggression and attacks that we saw from the former UCP government. And frankly, we are continuing to see that same level of political interference under Danielle Smith. With the resignation of Dr. Tailfeathers recently over the interference of this government in the Indigenous Wellness Corps, and that is a message that is rippling out across the healthcare system. Healthcare professionals are thinking long and hard about whether they would want to come to practice or continue to practice in Alberta. And that's going to have an incredible impact on our ability to deliver care, particularly primary care.
And then just as a follow-up, you mentioned a recruitment plan. Do you feel like that's the center of the solution?
I think there's a number of pieces that have to be in play that we laid out in our plan for family health teams. First of all, we need to empower a wider range of professionals to work in primary care. Family doctors are key. They are at the heart of primary care. They need to continue to be an essential part of that care. But there are others who can help build out health care teams, primary health teams. And again, you will find that is a solution being touted in every jurisdiction across Canada to address the crisis in primary health care. So whether it's nurse practitioners, community paramedics, social workers, others who can help provide that in family or in our family health teams, primary care teams, that's a key part of the solution. Certainly, we lack the number of physicians that we need in the province of Alberta. We certainly lack family doctors. We do need more. So in the shorter term, yes, we do need to recruit them from other jurisdictions. And there are family doctors who are looking to come to Canada or to move in Canada, looking for other opportunities if Alberta is an attractive place to work. But as we've laid out, in many respects right now, under this government and given its track record of aggression and attacks, it is not. Lastly, we also have to be looking at education and training. So we need to be training more doctors here in Alberta, opening up opportunities for training in rural settings, because people who train and practice and get experience in rural settings are more likely to want to stay and work in rural settings where we have so much of the need. So certainly there are a number of pieces, but recruitment is certainly going to be an essential part of that, particularly in the short to medium term.
So earlier today and yesterday as well, the Premier was asked about these EMS response numbers and opioids. She said that the supply that's on the street right now is being mixed with tranquilizers, and therefore it's difficult, and Narcan's not as effective. She also says there's no such thing as a safe supply of opioids. I'm wondering, what would you do to address this spike in overdose-related EMS calls?
So I'll give the Premier credit in that she correctly identified the problem. We have an incredibly toxic supply of drugs on the street, and it is killing people. But the Premier in her response is essentially saying, oh, well, there's nothing we can do about that. Literally just saying, people have the opportunity then, well, if they take those drugs, they play that Russian roulette and they gamble with their lives. Now, the Premier and this government have talked about their Alberta model, their investment in recovery and treatment. That is valid and good. That is an important part of the spectrum. But the fact is, of their commitment to build 12 recovery centers across the province, we so far have seen them complete one. in 4 years, while Albertans are dying in April in record numbers from drug poisonings. So we have been clear previously as the Alberta NDP that we would want to work with and support frontline professionals, doctors, folks who are working in the system who are providing alternatives to help protect individuals. The UCP is focused on a heavily ideological approach in denying the exploration of any further harm reduction supports. They're going against science. They are cherry-picking a few people who agree with their opinion, going after emotion and moralistic posturing over saving lives, taking pressure off our healthcare system, and allowing people to live long enough to access these recovery supports once the government gets around to building them. So our commitment would be to work with the frontline professionals to be collaborative and work on science-based, evidence-based policy to help keep people alive now.
Okay. And Nathan had mentioned the Jobs, Economy and Trade Minister's mandate letter. In the upcoming Health Minister's mandate letter, is there anything you want to see or don't want to see in that letter?
I think we laid out quite clearly today where the crisis points are in the system. Everybody knows these are where the issues are. These issues have been here for a number of years, and indeed a number of these issues, like say the lab situation in Calgary, the backlog in surgeries and the government falling behind in surgical capacity, are directly because of UCP policy and agendas that they forced through over the last 4 years. So what I would like to see in that letter is how this government is, I guess, a direction to the minister to take concrete steps to address these key issues. How is this government going to work to ensure that more Albertans in the next year, in the next 4 years, will have access to a family doctor or other primary care professional? How are they going to move concretely and quickly to address the issue with access to lab services in Calgary? What is this government going to do to actually support surgical capacity in the province of Alberta and stop undermining our public system and our public hospitals, where people are now having to wait days potentially for surgery in a public facility because the anesthesiologist has been sent to work in a private facility? We need to see direction from this Premier to her healthcare minister to have a real, clear, transparent, and accountable concrete plan to address the crises in our healthcare system.
Thank you. We'll go to our phone lines now. Michelle, your line should be open.
Oh, hi. Thanks for taking my question. This is a question for Nathan Ip. Nathan, I want to ask you also about the mandate letter for Minister Jones. There's something in the letter I was wondering about, and I have asked the government some questions about it. And it's consulting with Alberta private sector unions on ways to reduce red tape and aspects of Bill 32 that have made it unduly onerous for unions to make charitable donations. So I'm wondering, first of all, your reaction to that.
You know, I'll be honest, I am carefully studying the letter still, and I will be consulting stakeholders. I can certainly get back to you with a response, but at this time I'm still studying the letter as we speak.
Do you have a follow-up, Michelle?
Sure. Well, I want to know, does it strike you guys as curious that they only want to consult with private sector unions? It's quite clear in the letter that it's private sector unions they want to talk to, and obviously not public sector unions.
And certainly at first blush, that's problematic. You know, we want to make sure that all of our stakeholders across the province, particularly including our public sector unions, are part of that conversation, and that's something that we will certainly push for. But you know, I'll certainly get back to you with a more fulsome response.
Thank you.
Thank you, Michelle. We'll now go to our other caller. I think that's Lisa. Your line is open.
Hi, this is a completely unrelated question for David. I'm hoping to get your reaction to the latest provincial numbers on sexually transmitted infections that we saw just come out last week. We've seen an alarming increase in congenital syphilis, really big increases in the numbers, particularly when you add them all up from 2018. And obviously there might have been reasonable to assume, and experts kind of warned us during the pandemic that there might be a dip in testing and treatment. So I'm wondering what your reaction is to those numbers if you've had a chance to look at them.
Certainly those numbers are deeply concerning, and it's quite clear we need to take some quick and swift action to address this. We don't need another blossoming, I guess, public health crisis in the province right now with the stress and strain we already have in the system. What I can say is, it's unfortunate that what we have seen currently from the government, certainly its first steps and many of the steps since Danielle Smith became Premier, have been to attack and undermine our public health infrastructure in the province of Alberta. It's unfortunate, that the Premier came in with a long track record of indulging in conspiracy theory around so many aspects of public health that have contributed to undermining people's faith in expertise in public health. So that does not serve us well as we are looking to address yet another crisis here with the issue around syphilis. So what I'm hoping that we're going to see is that we will see a pivot, shall we say, from the Premier. That we'll see that collaboration, respect, and support that we so badly need across the system in supporting our public health experts to be able to work to, make some investments. Certainly we need to see the investments from government for public education and whatever other steps we can take to address this. We have been here before. I can't remember how recently it was, but in our not too distant history, we had a similar situation in Alberta. We were able to mount a very effective public education and engagement campaign to help bring STD numbers under control. And I believe it might have actually been on syphilis numbers at that time as well. So hopefully we will see that leadership from the government, perhaps something from Minister LaGrange soon to help address that.
Do you have a follow-up, Lisa?
Yeah, thanks for that. Just in terms of more of the specifics, because obviously a lot of these diseases are preventable with testing and early treatment. How do you reach more Albertans, specifically pregnant women, to get proper testing and increase that outreach, particularly in Edmonton and the North Zone, where a lot of these numbers are really high?
Well, there's probably a couple of tactics that you can bring into play that we saw work quite effectively actually during COVID-19. Certainly use of social media channels and those kinds of advertising campaigns can be very effective ways to get messages out to people. Secondly, working with people who have direct connections in those communities. So certainly in the north of Edmonton, we have a number of newcomer communities. We certainly have a number of folks with Indigenous background. We have a number of folks who rely, on other social services and supports in the community. So when we work closely with those who already have those connections in the community, it helps to get messaging out and also helps to create access. And that is the other point. We have to be able to offer that testing, that support, and that treatment in an accessible way. And that's part of the challenge we face, again, as we are facing this primary health crisis, which I have to say, again, has been made so much worse by the actions of this government. But it's essential that people be able to access those treatments and supports in their community from people who are culturally competent in the needs of the people they are meeting with, to ensure that they have trust in the folks that they are seeing, to be able to hear the message, accept the education, and be willing to accept testing and treatment. So I think those are opportunities that are available. Like I said, our public health experts, I think, did a good job overall in building some of those engagements during the COVID-19 pandemic. And it's hopeful that they will have the support of this government to activate them again.
Thank you. We'll just do one more pass for questions. Reminder, if you're on Zoom, it's the raise hand function. On the phone, it's *9. Seeing none, that concludes our press conference for today. Thank you.